So when we counsel our patients, we have a four-pronged approach. First is nutrition. You need to eat better. Again, your viewers know this. Most of your viewers are healthy. You're into this biohacking. Nutrition is really important. Second, exercise. We need to keep exercising. Our society has become, unfortunately, very sedentary, very difficult. Gyms are popping up everywhere, but we are the least healthy society that we've ever been, despite all of this overabundance of gyms and healthy foods. But no matter what, when you come to me, we do the nutrition, we do the exercise. Then we do the hormone evaluation. And it's not just testosterone. I get guys all the time when we do an extensive blood panel when they come and see. It could be insulin resistance. It could be thyroid issues. I've diagnosed a few guys with hyperparathyroidism that was mimicking as hypoandrogenism, as low T. It could be obstructive sleep apnea. You don't sleep well, you know what? All of those things. So I really look at all the hormones, and if testosterone is suboptimal or anything else, come up with a plan to fix this, but it's in correlation with the nutrition, with the exercise, and the other bubble that I added to a four-pronged approach is mindset. Mindset. That is such an important part of your treatment program. First, testosterone helps with your mindset. Testosterone, guys always think that testosterone is just for better sex, better muscles. One of the most abundant receptor sites is in the brain for testosterone. So guys will get a great boost of their dopamine. Testosterone does bind also with the 5-HT2 serotonin receptor. So increases mood, increases drive, ambition. We have reviews of patients who 3 months later, he told me, he's like, Doc, my life has changed. Not only I feel better, I look better, sex is better. He's like, but now I got the guts. I was able to open my own, this was a lawyer. It's like I quit my corporate law job and I was able to open my own law firm. Is it only testosterone that does that? Not likely not, but it's everything that we did together. And testosterone was a big driver of this increased drive. So I counsel my guys a lot on how to be a better person once we do those three approaches. We fix your nutrition, we help you exercise, we fix your hormones. Now you're going to see, be a more positive person. It's easier for you to concentrate, to focus on the positives. I say testosterone is the best thing to help you become more resilient. So I see guys with like type A personalities with a lot of responsibilities at work, a lot of stress. I'm like, I'm not going to change your work conditions, but I can make you withstand that stress much better. I can make you more resilient so you can deal with your day-to-day life much better, can be more present at work, can be more present at home, be a better father, a better husband. So testosterone for me, it is so ubiquitous in our life, and it does so much that once you start down that route, there are so many openings that you can do. So that's why I don't focus on a number. I focus on results and getting you to feel better. So our tribe, our guys in our clinic, I call them my theta tribe. Theta T for testosterone.